Heart palpitations are very common, especially in women. They may be startling and unsettling, but the majority of them aren't dangerous. They usually only last a short period of time and are rarely life-threatening. In fact, palpitations are often caused by things you can easily control or manage. In this video, we're going to discuss 10 symptoms of heart palpitations that generally don't require immediate medical attention, and then 5 serious warning signs that indicate it's time to go see a doctor, each backed by scientific studies. You'll be surprised how many palpitations are related to lifestyle factors. Are you ready? 10 common causes of harmless heart palpitations. Number 1, palpitations with stress or anxiety. It's common to experience palpitations during moments of stress or anxiety. When your body feels threatened, your brain releases adrenaline, triggering your fight or flight response. This adrenaline rush can cause your heart to race. A study published by the American Psychological Association in 2021 found that 40% of people who experience palpitations also report feeling anxious. Stress-induced palpitations are often harmless and subside once the stressful situation resolves or you calm down. However, chronic stress can wear on your heart over time, so learning to manage stress is key. Number 2, palpitations when you have magnesium deficiency. Magnesium is a crucial mineral for heart health, and low levels of magnesium can cause your heart to flutter or skip beats. A 2020 study in the Journal of Nutrition found that almost 50% of Americans failed to meet their daily magnesium intake, increasing the risk of palpitations. Magnesium deficiency can easily be resolved by consuming more magnesium-rich foods like spinach, pumpkin seeds, and almonds. A magnesium supplement might also help. Interestingly, those who consume enough magnesium are 32% less likely to experience palpitations due to this deficiency. Number 3, palpitations after consuming caffeine. Whether it's your morning coffee, energy drinks, or even certain sodas, caffeine is a stimulant that can lead to palpitations, especially when consumed in large amounts. According to a 2019 report in the American Journal of Cardiology, about 23% of individuals who drink more than 3 caffeinated beverages a day experience palpitations. This happens because caffeine stimulates your nervous system, making your heart beat faster. While caffeine-induced palpitations are usually benign, cutting back on your intake can help ease the problem. Interestingly, people who consume under 200 milligrams of caffeine per day reduce their risk of heart-related side effects by 50%. Number 4, palpitations due to lack of sleep. If you're not getting enough sleep, your heart can become more sensitive to palpitations. Sleep deprivation causes the body to release stress hormones, which in turn can affect heart function. According to a 2021 study published in Sleep Medicine Reviews, 33% of individuals suffering from sleep disorders report experiencing frequent palpitations. Getting 7 to 9 hours of sleep each night can significantly reduce the risk of palpitations related to lack of rest. In fact, people who sleep at least 7 hours a night are 25% less likely to experience palpitations compared to those who get less. Number 5, palpitations during hormonal changes. Hormonal fluctuations during menstruation, pregnancy, or menopause are another common cause of heart palpitations. A 2021 report from the British Heart Foundation found that 38% of women experience palpitations related to hormone changes. These palpitations are typically short-lived and not a cause for alarm unless accompanied by other symptoms such as chest pain or shortness of breath. Interestingly, postmenopausal women are 22% more likely to experience palpitations than premenopausal women due to the hormonal drop. Number 6, palpitations after taking certain medications. Certain medications, particularly those containing stimulants, can cause palpitations as a side effect. Decongestants, asthma medications, and even some antidepressants can cause your heart to race. Harvard Health published a study in 2020 that found 12% of people who take decongestants report palpitations. While these palpitations are rarely dangerous, always consult your doctor if you're concerned about side effects. Number 7, palpitations after consuming seed oils. Seed oils like soybean, canola, and sunflower oil contain high levels of omega-6 fatty acids, which can contribute to inflammation and lead to palpitations. Research published in the Journal of the American Heart Association in 2021 found that individuals who consume large amounts of seed oils are 15% more likely to experience heart palpitations. Americans unknowingly consume an average of 80 grams of seed oils per day, largely through processed foods. Reducing your intake of these oils could help stabilize your heart rhythm. Number 8. Palpitations after dehydration. Being dehydrated can cause your electrolyte levels, especially sodium and potassium, to drop, which can trigger irregular heartbeats. The Mayo Clinic, 2021, found that dehydration accounts for 1 in 4 reports of palpitations. Drinking adequate water helps regulate blood flow and maintain normal heart rhythms. On average, people who hydrate properly experience 18% fewer palpitations. Number 9. Palpitations after heavy alcohol consumption. Drinking too much alcohol, particularly binge drinking, can irritate the heart muscle and trigger palpitations. A Journal of the American Heart Association study from 2020 found that 30% of people who drink heavily experience palpitations, especially during holidays or social gatherings. These alcohol-induced palpitations typically aren't dangerous unless combined with other risk factors like high blood pressure. Cutting back on alcohol can reduce your risk of heart palpitations by about 25%. Number 10. Palpitations after eating large meals. It's not uncommon to experience palpitations after eating a large meal. Overeating can cause your heart to work harder as blood rushes to your digestive system. A 2018 study from the American Journal of Gastroenterology found that 15% of people report palpitations after consuming large quantities of food. These post-meal palpitations usually go away once digestion is complete, and eating smaller, more frequent meals can help prevent them. People who avoid overeating experience 20% fewer digestive-related heart palpitations. Now that we've covered the 10 types of palpitations that are generally harmless, let's get into the 5 warning symptoms that you should never ignore. If you experience any of these, it's time to go see a doctor. Number 1. Palpitations with chest pain or pressure. Palpitations that come with chest pain or pressure may indicate something serious, like a heart attack or other heart condition. The American Heart Association, 2021, found that 40% of people who experience chest pain with palpitations are at high risk of a cardiac event. If you ever feel a squeezing sensation or pain in your chest along with palpitations, don't wait. Seek medical help immediately. Number 2. Palpitations with fainting or dizziness. Feeling lightheaded or faint during a palpitation episode can be a sign of arrhythmia or another serious heart issue. A 2022 study in the Journal of Clinical Cardiology revealed that 30% of people who faint during palpitations have underlying heart conditions, such as atrial fibrillation. If you experience dizziness with your palpitations, it's critical to get checked out right away. Number 3. Palpitations with shortness of breath. If you're having difficulty breathing while experiencing heart palpitations, this could indicate congestive heart failure or another lung-related issue. According to the American Lung Association, 2020, 28% of individuals reporting palpitations and shortness of breath required urgent medical attention. Never ignore this symptom, as it could be a sign of something more severe. Number 4. Palpitations that last over 10 minutes. While short, sporadic palpitations are usually harmless, palpitations that last more than 10 minutes could signal an underlying heart issue, such as arrhythmia. The Circulation Journal, 2019, noted that individuals experiencing prolonged palpitations often have more serious heart conditions. If your heart continues to race or flutter for more than 10 minutes, it's time to see a doctor. Number 5. Palpitations with a family history of heart disease. If heart disease runs in your family and you experience frequent palpitations, it's a good idea to see a doctor. A 2020 study published in The Lancet found that individuals with a family history of heart disease are 50% more likely to develop cardiovascular issues themselves. Frequent palpitations may be an early warning sign, so don't ignore them, especially if heart disease is prevalent in your family. And there you have it. Most palpitations are harmless, but it's important to know when to take them seriously. Next, check out this video right here. I think you will love it. Thanks for watching Healthy End, and we will see you there.